Caring for older adults requires more than just medical attention. It involves patience, empathy, respect, and the ability to support daily personal care routines with confidence and dignity. In this video, we'll demonstrate step by step how to assist with important daily tasks, including changing clothes, assisting with tub and shower baths, helping with oral hygiene like brushing teeth, removing urinals and bedpans, collecting urine and stool specimens, and supporting the nurse in preparing and administering oral medications. These tasks may seem simple, but when done correctly, they contribute greatly to an elderly person's health, comfort, and quality of life. The purpose of assisting with elderly care tasks is to promote the health, safety, comfort, and dignity of older adults who may have limited mobility or conditions. Assisting elderly in changing clothes. Wash your hands and knock the door for courtesy. Bring clean hospital gown to bedside. Raise patient's shoulder from bed as much as needed to locate the thighs. Take gown sleeves off the arms but leave it across his or her chest for the time being. The rationale for this is drape the patient appropriately to prevent unnecessary exposure of his or her body. Place the clean gown over and slightly lower than the used one. If the patient has disabled arm, place the sleeve on that arm first. The rationale for this is sometimes patients speak of their bad arm, which may only mean that it is stiffer than the other, considered it as a disabled. Put the sleeves by placing your hand through the clean gown sleeve and gather it up. Then, still holding it so, gently grasp the patient's hand or wrist. Still holding the gathered sleeve, use the other hand to pull sleeve into position. The rationale for this is it is not necessary for the patients to fumble and poke here and there trying to find the armhole. Repeat this step with the other sleeve. Holding the clean gown by collar at patient's chin, slip the other hand underneath the clean gown and pull the used gown off the patient. Look for personal items which may be pinned to the gown. Then fold the used gown and place it in the laundry hamper. The rationale for this is to give particular attention to look for these articles, and they might be cheap or common items but very valued to the patient. Next is to adjust the clean gown at the shoulders and back, then fasten snaps or strings at the back and neck. Next is do the aftercare. Remove gloves and hand wash. Then lastly is record and report. Assisting elderly on tub bath. Assisting the elderly with the tub bath helps keep them safe, clean, comfortable, and respected. Preparation of equipment. place rubber mat at the bottom of the tub. Next is place a bath mat. And then place a bath blanket at the back of the chair to cover the patient after bath. Next is extra towel for drying the hair of the patient. Next is assemble the equipment like washcloth, sponge, soap within reach. And lastly is to make sure that the tub is clean. Wash your hands and knock the door for courtesy. Assess readiness of the patient and explain the procedure. The rationale for this is to be sure that the patient is allowed to take tub bath. Also, if in doubt, check the patient's chart in the nursery station. Assist the client to a sitting position on the side of the bed. Help the patient if needed to finish dressing in bathrobe and offer sleeper. Accompany or transport patient to the bathroom. Let client sit on the chair near the tub. Hang in occupied or in use sign. The rationale is clients need privacy while bathing. Next is explain or instruct precautions for safety. And then fill the tub with warm water. The rationale is to keep the client warm to prevent chills. Help the client into the tub providing necessary assistance. Leave the patient alone during bath but do not leave the vicinity of the bathroom. Check on the client within 10 to 15 minutes. Be alert for any silence. If bath is done, instruct the patient to pull the drain plug. Take bath blanket on the chair to cover her body. And provide necessary assistance in taking the client out of the tub and sitting on the chair. The rationale is draining water and assisting the client getting out of tub help prevent falls. Next is to assist the client with dressing and grooming. Help the client to return to her room, return to the bathroom, then clean the tub and discard soiled linens. Also, don't forget to place an occupied sign on the door. The rationale is to maintain cleanliness and good infection control practices. Next is wash your hands. Lastly is record and report. Assisting elderly on shower bath. Preparation of all equipments and supplies. Test the faucet function. Then place the rubber mat on the shower floor and stool over the rubber mat. Place a chair and bath mat outside the shower stall. Also place a bath blanket. The rationale is to maintain cleanliness and safety for the client. Wash your hands and knock the door for courtesy. Next is to assess the readiness of the patient and explain the procedures. First is to assist the patient to a sitting position on the side of the bed. Second is to assist in standing. Next is to accompany or transport clients to bathroom using a wheelchair and offer sleepers. The rationale is showering or bathing will be tiring, so transportation in a wheelchair will conserve energy and accompany the client to avoid sleeping. Let the patient sit down on the chair outside the shower room. And then next is hang occupied or in use sign. And then explain and instruct precautions for safety. And then lastly is turn on the shower and adjust the water temperature. Let the patient check it. Help the client into the shower room. If the client is showering independently, check on the client within 10 to 15 minutes. Stay close to shower opening. The rationale is prolonged exposure to warm water may cause vasodilation and pooling of blood, which can result to lightheadedness or dizziness. Take note that if the patient is unable to shower independently, then always stay with the client. Use handheld shower. Turn off the shower. Offer bath blanket to cover himself. Help the client out of the shower. The rationale is assisting clients helps prevent falls. Next is to ask the patient to sit on the chair outside the shower room. Then assist the client in drying, dressing, and grooming. After this is help the client to the room. Next is to return to the bathroom and discard soiled linen. Return articles to proper place. Place an occupied sign outside the door. Then wash your hands. Lastly is record and report. Assisting patient who is able to brush teeth. Prepare necessary equipment and supplies. Wash your hands. Give the patient an opportunity as often as time permits to wash his teeth after he eats. The rationale is do not deprive the patient of caring for himself. Also, do not let the patient rely on caregiver. Give assistance if he needs, but do not perform all the procedures for him unless he really cannot do it. And knock the door for courtesy. Place articles or supplies on the overbed table. Assist the patient to sit up. Assist patient as necessary and offer help to rinse mouth. But if help is not needed, leave her alone. Remove articles for cleaning when patient is finished. Do the aftercare, which is remove the gloves and hand wash. Then lastly is record and report. Giving and removing bedpan. First is you need to do assessment. Decide how much assistance does the patient currently needs. Then next is check the patient's activity order and physical status to determine whether a bedpan is necessary. Wash your hands and put on clean gloves to protect both the patient and you. And knock the door for courtesy. Explain the procedure to the patient. Close the door and screen the patient. The rationale for this is to provide privacy. Raise the bed to the high position. With the patient in a recumbent position and your hand under the small of the back for support as the patient to raise the buttocks. By raising up with the feet as you push the pan into position under the patient. When the patient signals, return promptly. If necessary, clean genital area with toilet tissue from anterior urinary region to posterior region. Then remove the bedpan, cover the pan. Carry the pan to the bathroom and then collect the specimen, measure the urine, and note for amount, color, consistency, and odor. Empty the content into the toilet and flush, and then thoroughly clean bedpan with cold water. Remove and dispose gloves. Place the bed back into low position for safety. Next is do the hand washing. Note efficiency of the technique used and how suitable for the patient. Lastly is the document procedure. Assisting the nurse with preparation and administration of oral medication. Transcribing confirmed doctor's order to individual patient cardex. Preparation and transcribing of medication card as per institution, standard frequency, color coding per patient based off the cardex. Medication card content. First is the name of the patient, second is the room and bed numbers, third is the date ordered or prescribed, next is the name of drugs, then write route, and then write dosage, and then time of administration, the name of nurse who transcribed the medication card, and name of the prescribing doctor. Wash your hands. Medication administration. Write patient. Always verify name and DOB with the MAR. Next is write drug. Double check the medication order. Write dose. Use correct calculations and check with another nurse if needed. Write time. Some meds need to be given exactly on time, like insulin or antibiotics. Lastly is write documentation. If you didn't chart it, it didn't happen. Read the label, remove the cap, and gently shake the prescribed number of tablets or capsules. Place the medicine glass with tablet or capsule at the top of medication card for specific patients. For the preparation of liquid meds, open the cap and pour the medicine along the unlabeled side of the bottle to the medicine glass at eye level. After properly preparing the medicine and reconfirming the contents of the medication card accordingly, proceed in assisting the medication nurse in the administration under his or her supervision as per institutional policy. Assist in giving meds. Assist the patient and leave him comfortable. Wash your hands. Document the procedure done. Collecting stool specimen. After confirming doctor's order, explain to the patient the need of stool specimen for analysis. Materials that are needed: ball pen, commode, disposable gloves, and lastly specimen bottle. Wash your hands and knock the door for courtesy. Instruct the patient on how to obtain stool specimen and offer bedpan for bedridden patient. Next is wear gloves. Use spatula to obtain specimen. Next is close the specimen bottle tightly. Discard remaining stool into the toilet bowl. Clean and dry the bedpan. Remove gloves. Wash your hands. Lastly is document the procedure. From offering and removing urinals to collection of urine specimen. Wash your hands and knock the door for courtesy. Ask if the patient is okay with the procedure. Always provide privacy by closing curtains and doors during excretion. Raise the head part of the bed to assume semi-sitting position. Position the patient properly. Instruct to flex both knees. Position the urinal. Cover urinal immediately after excretion. Damp disposable towelettes. Dispose properly. Transfer the specimen from urinal to specimen bottle, filling 2/3 of the sterile container. Next is close the cap tightly. Send specimen to laboratory with laboratory request form completely filled up with information. You can put back the bed to a flat position. Discard remaining urine in the toilet bowl. Clean and dry urinal. Next is remove the gloves. Wash your hands. Document that urine specimen has been collected.
Go!
Di ba nakahawak sa
Kaya nga, kailan ko palala kapag nakatayo?
Ilak mo na sa pagkakita ng pasyente, magpakilala, magbaw ng konti, magbaw.
Excuse me po, natanggal na yung dextrose ko. Wala kang crowd control.
Hindi ko sa suka.
Ay!